Hi, good evening.
Good evening, ma'am.
Do we have only three participants today?
No, ma'am, there was a confusion. So 6 o'clock only we received that link. So I am
Okay.
calling everyone and informing. So
Okay.
it will take some.
Yeah, I'll wait. I'll wait.
Yeah, good evening, ma'am.
Good evening. Good evening.
Hello. Hello, Shilpa madam.
हेलो गुड इवनिंग सर।
मैडम आप है ना होस्ट हो गए हो, तो मुझे आप जीएमसीबी पर राइट क्लिक करके मुझे होस्ट बना सकते हो।
मैं होस्ट हूँ।
हाँ, आप होस्ट हो गए हो।
ओके क्या करना होगा सर?
जीएमसीबी पार्टिसिपेट है ना, वहां पर जीएमसीबी लिख कर आ रहा होगा। उस पर जो थ्री डॉट है ना, उसमें जाके रिक्लेम होस्ट रोल में मैंने किया है, सिर्फ आप यस दे दीजिए। ओके, थैंक यू मैडम।
ओके सर।
And whenever you give me the go ahead, I'm ready.
I tried Jyoti madam. She's not picking up. Meenakshi is not joining today. And 7 of us have joined.
So should we start? Should we wait? I'm not sure. Like,
Siddhartha, Dr. Siddhartha will be joining. He
okay.
said in few minutes I'll join. Jyoti madam has not picked up the phone. Meenakshi is not joining.
Sure. So shall we go ahead then? Okay. Hi, good evening.
Good evening,
Good
ma'am.
evening, ma'am.
Yeah, good evening, ma'am.
Good evening. It's been 15 days since we last discussed. So I just wanted to ask you all, like, what concepts have you understood or retained or want more clarity on? Oh, well, this is not a didactic lecture.
Let us refresh little bit because we have
Done
15
that.
days has been gone.
Can you
So
speak loudly?
let us refresh little bit so that we can go to that mode again.
You want me to refresh? Fine. Okay, here's a share button. Yeah. You're able to see my screen, right?
Yes, ma'am.
Okay. Yeah. Oh, well, this is what we started off with in the last session. I'm not going to go to the complete one. Okay, I guess I'll be looking at a blank screen. All right. So when we discussed last time, we spoke about what is the curriculum part of it. And the main objective of the last session was to understand the curriculum. This session, we will look at how to analyze gaps in curriculum because you are all going to be designing curriculum by yourselves, right? So when you're designing any curriculum, first we learn through the models that we need to analyze the gaps. So that's what is our focus going to be. So for a quick revision, we just discuss on what is it that you already know. So we went through a few terms. We discussed the term curriculum. What is a curriculum design model? Then the different components of a taught curriculum, a hidden curriculum, an explicit curriculum, learned curriculum, etc. Then curriculum is also called in using different terms. Component, it's a competency-based curriculum, it's a problem-based curriculum. So depending on what is the major focus of the teaching, please let me know if there is any interruption in the screen sharing. It's saying that my internet is slow, but I'm not sure of that. Okay, and we also learned about a little bit on spiral curriculum. Now, on these components, do you have any questions for us to discuss? Yes or a no will really help.
Ma'am, if you are assessing a student, how much he has learned clinically, will that come under the curriculum development program?
Assessment
Like
Is-
direct observation procedure
Yeah.
for the student, how much he has learned clinically and how much he is able to implement the clinical thing.
See, assessment is definitely a part of the curriculum. But assessment by itself is not curriculum.
If I am
It's
going to use the DOC procedure, will that come under the curriculum development? Direct
definitely
observation.
the docs is a part of the curriculum development. Is that what you're asking?
Yeah. Is DOC part of curriculum development?
Um, it comes under assessment strategy, madam.
Okay.
It's a component.
Mhm.
Say it's a curriculum by itself.
Mhm.
Because we'll have to link it and see or use the term curriculum mapping to see how is this assessment linked to the learning objective, how is it being delivered. So if you're doing all that, then it is part of the curriculum development. So the curriculum is a very big structure. In that, assessment is one component. Okay. Any other question? Okay. So moving on. So we looked at the different dimensions of a curriculum. So this was the question we had. Is curriculum an assessment method? Is curriculum a teaching method? Is it only content? Or is it timetable? Is it writing down the objectives? Is it the cognitive part of it? Is it related to students or patients or teachers? How do I look at it? Do I look at it as a competency? Or is it at an organization level? Who should deliver this curriculum? So, depending on who you are, for example, if you're an administrator, you will be looking at how this curriculum aligns with your organization. If you are a curriculum designer, you will look at what is the objective, what is the competencies a student should be getting. If you are the one who is implementing the curriculum, you will focus on what are the specific learning objectives, what is the teaching method that should be adopted, what is the assessment strategy. So depending on which hat you are wearing, you'll be looking at it. So curriculum is everything and beyond that. So it's a statement which contains all these components. It should have a description of the entire training structure, the method, and this is also a component of the supervision which comes in here. Now, it should be both generic and specialty specific because you are never going to be, no curriculum is a standalone curriculum. It's always integrated with the other subjects out there. And very clearly, it should articulate what should be the skills and attitudes and all it should achieve. And most importantly, it should be contextual. This is what we discussed last time in depth. Contextual means how is it relevant to the particular set of people whom the dental students are going to be treating when they pass out or during the training program. Okay, so we went through this. We went through what are the specialized roles which are required in curriculum designing because it's definitely a different role altogether. So that's where you have the instructional designers coming in and you're involving key stakeholders. So that's a component of co-creation which comes in and involve the community also because it is context specific. And then we had a look at the sixth and the seventh ones. Yeah. The different curriculum design models. And we suggested that maybe you can have a look at Kearns because that is the most widely used. Did you all get the resource material which I had shared?
No.
Yes, ma'am.
Yes.
Okay. So were you able to have a look at it?
Ma'am, I didn't go through it, but I saw it. It's there.
Madam, was it through LMS or directly on the?
I'm not sure.
LMS.
Shared.
In the LMS.
Okay. And we had a look at this and then this is Kearns, wherein the first step is always the need identification. Second is who are your learners? Why you need to be focusing on them? Specific goals for a particular curriculum or a model or whatever you want to call it. How will you ensure that those learning objectives are met? So what is your educational strategy? What's your implementation method? And the whole curriculum being evaluated, what is the feedback taken? So these are the 6 simple steps for you to look at when you are having a curriculum development component. So at the end of this module, I expect that you're all expected to design a model, right? Am I right in my interpretation? Yeah. Okay. Now, long back, Hardin suggested these things. He said a curriculum should always be student-centered. It should be not just about information gathering. Right now, our curriculum is largely information gathering. We have too many things stuck into that curriculum, but rather it should be focusing on problem. So, for example, you have a geriatric patient who walks into your clinic who is 85 years old and wants an implant. So, critically analyze whether the patient is suitable for implant. What are the other issues you're going to consider? Who are all going to be on your team to deliver this implant? What is going to be the cost? Will the patient be able to afford it? If not, is there insurance available? So several questions are going to crop up when you give a scenario or there is a problem to solve. Contrast that with an information gathering session where the student is just led with the information. Now, what I'm doing with this session is trying to make it problem based. Okay. So right now I'm giving you the information because I assume that you can't solve a thing without having any background information. It would have been lovely if you had read the articles because the background information would also be with you. So that's part of the self-directed learning which comes in. Unfortunately, like teachers and students, we don't read up. So which means in this session we'll have to go through that. So do I look at discipline-based or integrated? I was at the APMEC conference, the Asia Pacific Medical Education Conference. And I was interacting with, we had participants from 38 countries, faculty from 38 countries. So I was talking to a lot of them. 90% of them have already shifted to an integrated curriculum. And you know, I'm not talking of European countries or I'm not talking US. This is from Pakistan. Pakistan has an integrated curriculum, which they adopted 20 years ago. And I checked with people from Cambodia, from Vietnam, even in Bangladesh, they seem to have shifted to an integrated curriculum. Whereas in India, we are still stuck with a discipline-based curriculum. So we are lagging behind by almost 40-50 years in our way we are delivering our education compared to the global standards or globally whatever is happening. So education should be community based. It doesn't matter. It's not a public health dentist who should be treating in the community. It is the role of every student, every teacher, despite the profession they belong to be working for the community. Electives. So this is something which has been introduced in the medical curriculum. Probably they might introduce it in the dental curriculum. And there should be a systematic approach to the way a student learns. So dimensions of a curriculum as identified by Hardin. This is similar to what I had asked you in the beginning as to what constitutes a curriculum. So curriculum is not just one component, but it is multiple things which add up to a curriculum. So what we generally refer to as a curriculum is a syllabus and not curriculum. So please understand, the moment we use the term curriculum, your mind should automatically think of what should be the learning location, what should be the learning resources we are providing, who is going to deliver it, how am I going to design the timetable? Okay. So if you're thinking of, I'm going to look at learning outcomes, content and assessment, that's a very tiny part of what actually is a curriculum. So please pay attention to the other components as well. You should always keep your students at the center because they are the core. And how will the curriculum run? What is the financial requirement to run this curriculum? How am I going to take the feedback? How do I know that this curriculum is working the way it is supposed to work or I thought I should work? All this should be planned into your curriculum design. So it's not just a matter of putting in some content, putting in some objectives. Look at the bigger picture of it. And I was happy to Yeah.
Ma'am, what is the meaning of learning opportunities here?
Okay. Learning opportunities means I want my student to know how to make a full denture. How will my student make that full denture? Is he going to practice it on a dummy? Is he going to practice it on a real patient? Or is it going to be a simulation? If it is in any scenario, how many opportunities will that student have to practice? So is it like they do only one CD and then we say, yes, perfect. We know how many times a prosthodontist has to work on a CD to get it right, right? So is it that level itself? Or are we going to create multiple opportunities for them to practice or learn? So all that matters, yeah, learning opportunities.
All right, ma'am.
Yeah. So I was very happy to meet Harden at the Asia Pacific Medical Education Conference. I was in Sri Lanka last week, and that's why I could not take your session last Tuesday. And this is Dr. Pushpanjali, my mentor and my guide from post-graduation days. She's a public health dentist too and a FAMO fellow and also with an MHP background. She might come to you guys too as a faculty sometime in your course. Depends on Dr. Suhasini Nagda. We all took a session together last year. So when it comes to principles of curriculum
Madam,
design,
I think she is in MS Ramaya, no?
yes, she's in Ramaya.
Thank you, ma'am.
So please, I'm reiterating it once again. Your curriculum should always be context specific. For example, when we ask you to design a curriculum, most of you will jump in and say, I want to design an implantology module for interns. My question is, justify it. Why? Why do you want to design an implantology module for your students? Do your patients really need implantology? Or is there a particular need you have identified which is relevant for your population group? Right? And your module is never sacrosanct and it should not be touched at all. It is always evolving. Please remember that. So there should be feedback taken. There should be constant evaluations happening and it should be improvising. And with the evaluation, you will also ensure that you're properly goal-based. I am designing this curriculum because I want to meet this end goal. So you're not going to waste your resources, which is very, very crucial. So if we don't know where we have to go, we will not be reaching there at all. Okay. So this is where we stopped last time. You need to have a very clear picture of the end product, which is your curriculum. What is the use of that curriculum? Where it is going to be used? What is your implementation process? And how will you evaluate your curriculum? Yeah. Any questions, please go ahead and ask. I don't want this to be a didactic component. I'd rather keep it very interactive.
Ma'am, I have a query.
Yes.
Ma'am, when we have a contest specific curriculum designing, and when we are evolving and giving the inputs and outputs of this for our evaluation, so where are we standing, ma'am? So when is our curriculum is designed? That means when we design one curriculum, when it get matured and applicable.
As soon as you design your curriculum,
Okay,
it's not you alone who will design it, right? You're going to be doing it as a team effort. So with
okay,
you're going to ideate, you probably will involve students. You'll also probably identify what the patients want and you'll have a curriculum ready. Implement it.
okay.
If you implement it, take feedback from your students who are the end users, from your patients, like we are teaching the students this, is this really working? Or you have taught the students that skill and the students are now able to practice it. So is that working? So you're going to get the feedback. So maybe you run it for 6 months or 1 year. You collect all the feedback and then you make modifications. So there are two ways of looking at it. One way is like As and when you get the feedback, you try to incorporate it and improvise it. If it is a very crucial kind of a feedback, or if there is certain changes which can wait, you wait for the end of that cycle, the curriculum complete implementation cycle, then you incorporate it for the second year. So there is no question of a curriculum being mature enough, because like I said, it's a constantly evolving process. So you cannot say that I have created this curriculum 10 years ago, it is now mature and it should fit. No, because your learners' generation gap also would have occurred. Every 5 years, there's a generation gap. So you have to cater to that. There would be new teaching methods which have come up. There would be different assessment strategies. Patient needs might have changed. So you can never say that you need a mature curriculum.
Ma'am, what I mean is, so when we design a curriculum, we test the curriculum rather than implement the curriculum. So after testing it for some time, because once we implement a curriculum, then it would be used for few years. So that is already been used, so it cannot be changed. Like a final year, we have given a curriculum. So that is being tested before it get implemented. During the testing time, we are evaluating, we are taking the input and output, and finally it good acceptance from all the stakeholders, then we implement at the end. That's what I wanted to know.
No,
No,
that is not what it is. You develop a curriculum,
okay, ma'am.
implement it, you
Okay.
take feedback, keep on changing it. That's it.
In case if we make a curriculum for a preclinical prosthodontics, second BDS, so now we have implemented it. So that year, the academic session of that year completes. So we take a feedback of these things, and the subsequent year we may add up to the changes to the curriculum. That's what you mean, ma'am?
Yes.
All right, ma'am.
So there is no such thing as designing a curriculum, implementing it, and then you test it and then you say, this is perfect, let me keep it for another 5 years. It doesn't work.
So that means the dental council or the council which is going to implement, or the university which is going to give us the curriculum for the specific years, are in a dynamic motion. Like every year they are giving you a curriculum.
Yes, ideally, yes, that is what they are supposed to do. But in India, we have a very static curriculum. What you and I studied during our BDS days is quite similar to what the undergrad student is studying nowadays. That is the reason why we are still struggling to remove amalgam from the curriculum. And every year when the curriculum content revision happens, the curriculum is not getting revised, the content is getting revised. People are adding more and more content rather than seeing what is it relevant or not. That's the reason that content is so overloaded.
Okay.
Right? So that's why the next generation of curriculum designers, which is your group, should be aware of this, that it's a constantly evolving process. We can't prepare something and stick to it. One component of testing which happens is called as a pilot testing. But we don't call it as pilot testing, we call it pilot implementation. Because we are not assessing whether the curriculum is good or bad. We are seeing how well this curriculum meets its objectives. Logistically, when I'm implementing this curriculum, are my teachers well prepared? What kind of resources I need? So you're basically evaluating the curriculum process. So you don't call it pilot testing, you call it pilot implementation. So let's assume that National Dental Council decides today that they're going to introduce competency-based curriculum. And they say tomorrow all the 393 dental colleges should implement competency-based curriculum. What will happen?
So without training, it will be chaos.
Yes, perfect. Without training, there's going to be chaos. Then what else?
even the trainers are supposed to be trained in a way that a competency can be.
Yes.
So trainers.
So trainers need to be trained.
So if something is going to be implemented or thrust upon all the colleges, so that means the curriculum has already been designed, and we have to just follow it. Or do we have any role in, when we say curriculum designing, that thing is probably a finished product is going to be given to us.
So there is no question of a finished product. Simply because National Dental Council will say these are the objectives, these are the probable content, this is the summative assessment strategy. How you teach is up to you. Or they might micromanage it to a level and say these are the must know, good to know, desirable to know. You should be teaching this in lecture. This is like this. Like what happened with the NMC curriculum. But the curriculum they have designed is not a proper competency-based curriculum. So it's absolute chaos. And our dental faculty don't know what is competency-based curriculum. Students also are not aware. So what is going to be the end product? It's going to be a chaotic thing. Otherwise, if NDC says, let's pilot implement this in 5 dental colleges for the next 2 years. They implement it. They figure out what are all the challenges which comes. In those 2 years, they train faculty in the other 391 dental colleges and then says, look, these are the modifications we have made, go ahead and do this. Then what happens?
That would be a more sensible thing to do.
Exactly. So to just give you a parallel, in 2015, NMC came up with a vision document and said, this is what we want our learners to be at the end of 5 years. For the medical graduate, they came up with a vision statement. From 2000, even before they were training, but from 2015, the faculty training became more and more. So they have a basic medical education program. They have an advanced medical education program. Every college is mandated to have a medical education unit, which conducts faculty development training and all that. They also develop guidelines for faculty. If this is the curriculum, how it should be implemented. So they develop notes, additional training and all that. With all these things in place, I think it was in 2019, they finally implemented the competency-based curriculum. So now the first batch of competency-based students are graduating. So with that level of preparedness also, so there are around 516 medical colleges, I believe, number must have increased now. They still had some logistical challenges. So as and when they get the feedback, they're reiterating, changing. COVID happened, they took the feedback, they cut down some period, they made our online transition easy. So like that, so curriculum is a living object. It keeps on getting modified. It's never a static thing. Okay. So when someone is designing a curriculum, you need to have a very clear of what's your end product, who is going to use it, what is the implementation process, and how are you going to evaluate it. So it's not just about putting content together. You should have your evaluation plan ready. What are my outcome indicators? How will I know that my curriculum has met its goal? What are all the components I should be looking at? So when you guys design your module, please pay attention to all these 4 components. A clear picture of the end product, who is going to use it, what is the implementation process, and how will you evaluate your curriculum. Okay.
Ma'am, I have a query. What we understand competency-based curriculum means we should be doing what we have learned rather than knowing what we have learned.
Yeah, that's one way of putting it. The other way of saying that is, let's say that you need to fabricate a complete denture. So can the student, how much does the student know or understand about a complete denture? How much does the student, is the student effectively in a position to communicate with a patient? Is the student able to make an impression appropriately? And let's say do border modeling and jar relation and all those sub levels, right? So have those sub levels on one side, and let's say they are all in columns, okay, in the rows, in the different rows there, and in the columns I have a novice student, a student who does not know any of it, a student who knows some part of it but not completely, a student who is competent, which means he or she is able to do all these steps, or someone who is really good at what they are doing and they can manage it without any kind of supervision, and someone who is an expert. So you always have this rows where you are comparing the subcomponents against a scale which says that my learner is a novice learner or at a very beginning stage, an advanced beginner, a competent person, a proficient person, an expert person. So it's not a very simple thing of saying knowing and doing. It's not that. On that gradation scale, where do they stand?
So the grading during the assessment also happens in this way, ma'am. If we develop a curriculum, the grading happens based on his competency.
Exactly. So it is important for us to identify what are the competence that we want in our dental student.
So the level of competency has to be decided by
Absolutely.
the
Absolutely. You're right.
but
Not only that,
at the BDS, at the MDS level.
yes.
Uh,
And also we need to determine how do we certify that they are competent. So that scale, what I told you, having sub competencies and then a scale of novice, advanced, beginner, competent and proficient and all that. So that scale is called as a rubric. So whenever we do an assessment, we always have a rubric, because ideally competency-based curriculum does not go with typically a pass or fail decision like how we are doing in currently. It says every learner needs to become competent. So let's say we have this quota system, no? What is the quota for CDs for students as per DCI?
5 complete dentures.
5 complete dentures. So DCI has arbitrarily said that a student needs to make at least 5 dentures to say that that person is competent to make a CD. But there might be students who are able to fulfill every step of it in 3 dentures only. There might be students who need 10 dentures, 10 types of exposures to say that they are competent in all those steps. Right? So this is where the student-centered learning comes in. As long as the student is not competent, he or she will keep repeating that skill. Once that competency acquisition comes and you as a faculty say, yes, this person is competent in this step, they cannot go ahead. Am I clear?
Yes,
Yeah.
madam.
Ma'am, how do we start to understand the competency base? Like after the completion or in the beginning of the curriculum?
Competency is, when we talk of the whole dental curriculum, it is going to be said that at the end of 5th year, at the end of internship or at the end of final year, the student should be able to do this. Generally, there's a very broad statements. It will say they should have critical thinking skills, they should have communication skills, they should be having dental expertise. So like that, we'll come up with broad statements. Okay.
So basically, we have to list out the things where we can assess the competency based on these list.
That is for the whole of curriculum, and for the whole of BDS curriculum. When it comes to prosthodontics, so you will come up with a competency statement and say at the end of their final year, an undergrad student should be able to perform a removable partial denture, place a removable partial denture, or do a complete denture, or maybe you're looking at FPTs, or you're looking at implants, whatever is the new things which have come in. So you're going to make a list of those things. At the end of graduation, my student should be able to perform these things. So
Madam,
then,
if I may ask you, as far as I recollect, it is already there as a matter of statements. It is all there.
yes, it is already there. I'm so glad that you have seen your syllabus copy. It already says that. The question is, how are we training our students to achieve those statements? So are we doing it?
That is not there. I mean,
That is where the gap is, right? So now if
yes.
you are all aware that this gap is there in our teaching method or in our assessment strategy, that is where you will work on it and improvise that section of the curriculum. Okay,
And
so
also,
curriculum,
madam, you said we are now discipline based, and we have to move to integrated. With whatever recommendations have been given, are we moving towards any improvement, or are we going to get stuck with discipline based, like based on the spices model?
I'm not aware of what is the current curriculum thing, sir, because DCI got dissolved and NDC is not established. We are waiting for Lok Sabha elections to happen, I believe. So, and even in the medical curriculum, they have recommended integration, both horizontal and vertical integration. And because see, overnight it is difficult for the faculty to integrate everything. They'll be like, if prosthodontics and surgery will have to work together, you already have a boundary issue. If we talk of implants, then 3 departments are fighting already. So the next question is going to be, who is going to teach the student these 3 things? So we'll have to look beyond our curriculum, beyond our personal boundaries and say, this is for the benefit of the students that we need to have an integrated curriculum. So a lot of those challenges will have to turned out, but integrated curriculum is the way. I was speaking to a Pakistani delegation during the Asia Pacific conference, and I asked them, how have you done the integrated curriculum? So what they've done is they have the preclinical section is completely different. So they have separated. So they don't look at anatomy, physiology, biochemistry like that. So they have a preclinical section. And that preclinical section looks at what are all the objectives which should be realized for a student, for a medical student or a dental student. Then the whole team sits together. So they are in one department. They don't call themselves, I'm an anatomist, I'm a physiologist like that. They call themselves the preclinical experts. So with that sense of identity, there is no border crossing issues. So like that, if a prostho, surgery, perio come together and say, we are all implantologists. And then you start teaching your student, again, there is not going to be much of a clash. So this is some kind of an integration with strategies which have to be adapted.
Okay, thank you, ma'am.
Do you have any other question?
Ma'am, do you have to remember the nitty-gritties of each designing principles that we read, ma'am, the methodology of things, because they are very, they have variety of things into it. So how to remember all those things, or do you have to just check out the checklist and to follow it?
No checklist. You'll have to integrate it into you. That is why a hands-on course. See, when you're designing the hands-on module, you will have so many questions like now how you are asking me. So at that time, because it's a need-based question, whatever you learn will be deeply ingrained. On the other hand, if it's only a theory session, you will say, why is this? What use is this to me? So you will not remember it also. That is how adults learn. So always integrate with a practical component. Now, which component is it that you're asking? You're asking for the spices thing or you're asking for curriculum?
Ma'am, the curriculum design models, I feel the spices is the easiest to remember or to implement and things like that. You say Tyler, pick and curry, all these things are there to remember those things.
Let me clarify. Spices is not a curriculum design model.
Spices model that we learn, ma'am. designing models, curve, wheelers, stylers, turns.
I
And,
clarified that day, probably it's been missed out. Spices is not a curriculum design model. It's a model which gives a direction as to how an ideal curriculum should be. Okay, it says it should be a student-centered. Don't go with information gathering or a lecture mode, go with more problem-based approach. Look at integrated, a community-based like that. It is not a curriculum design model. Whereas you look at this model, it gives specifically what steps are required in design process. And you can't skip any step. You need all the 6 steps. Okay, if you look at this model, this is again a curriculum design model. And this is not just a curriculum, anything you're designing, you need these steps. If I'm designing a competency, I'm designing a problem-based curriculum, I need this model, a 4C ID model. Okay, Spices is not a curriculum design model. Spices is of a direction. Any other questions?
Madam, can I speak, ma'am?
Yes, sir. Yes, sir.
Madam, if any part of the curriculum, like you said, implant, it's related to 3 departments, but as per the syllabus, they have specifically divided into zones, like 3 parts. What the prosthodontist has to tell, what the surgeon has to tell, or whatever the perio people have to tell. But like when we discussed it among the 3 departments, we found that there is a gap in the curriculum. Like they're not understanding how to implement that into the preclinical aspect. Let's say in second years, what we are doing is since long we are doing into teeth arrangement and all, the preclinical part of implant thing is not integrated into the second year or in final year. So in this particular part, madam, when we speak of curriculum mapping, can we integrate this particular part into curriculum mapping, or it will be like revamping the entire curriculum?
See, when you map a curriculum, you will realize where the gaps are also.
Okay.
And take that feedback from the faculty and say, look, the faculty have identified this as a gap. The learners are saying that they're not able to understand. So this is something important. So let's adapt or let's develop a preclinical module for implant training.
Okay. Like, let's say, madam, we can assume that if any part of the curriculum is there, but it's not being practiced, so that part, when we integrate it into the curriculum, that can be called as curriculum mapping.
No. Curriculum mapping is a process of identifying what is there, what is not there.
Okay. Okay.
Then develop and integrate becomes an integral part of your curriculum. So the curriculum mapping process helps you to identify these things.
But exactly, it won't be a curriculum mapping, madam.
Pardon?
Exactly, it won't be a curriculum mapping, madam. If any part of the curriculum is left out, let's say geriatrics or ethics, these are what we found out is these are the 3 parts which is lacking. Let's say implantology, let's say ethics, let's say, madam, geriatrics.
By identifying that these things are missing, you are doing
Yeah.
curriculum mapping only, no?
Okay. 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 Okay.
Now, Patidar sir was saying that the competencies are already listed in the curriculum.
Yeah.
But when you look at the contents, when you look at the assessment, you feel that the students are not being taught all these things or they are not learning these things. So in your mapping of objectives, teaching method and assessment, you have identified there is a gap. So this
Okay.
process of identification is curriculum mapping.
Oh.
Clear?
Oh.
Okay. Now, like Dr. Siddharth identified that there is a gap in the preclinical curriculum. I want you to think of an area where there is a problem. Okay, just jot it down. let me know once you have identified what do you think is the gap area.
Madam, I was just thinking about Dr. Siddharth's point when it comes to implantology for undergraduate students. When legally it is said that every dentist can place implants, but it has never anywhere. What is the competency? At what what level of competency an undergraduate student has to reach? In syllabus, different aspects have been given to different departments, but there is nowhere it is said that to what competency, whether it is a UG student should be able to place a simple single implant or a complex case. So that has never been defined. So when a student passes out and he tries to do whatever, through doing some short-term courses, and he can call himself an implantologist. So legally he's on the right side, because on a broader level of defining competency, probably DCI writes one line ki he should be able to place implants, but the nitty-gritty of it, or the micro level teaching and evaluation aspect is not there at all in the curriculum.
Absolutely, you're right. And so DCI can be sued for this.
Yes.
Because you're putting it as a competency, but nowhere are you assessing it. And on what basis are you certifying that statement and saying this student is eligible to place an implant? Who is going to handle the repercussions? So the DCI as a watchdog, which is to ensure that the quality of the graduate is maintained, is failing, right? So that's a very big gap.
Similarly, even in orthodontics also, there have been a lot of cases where I think in Kerala, there are a lot of people doing short-term courses in ortho, and most of the BDS graduates are doing fixed ortho treatment. So there is a huge this thing between the orthodontic society and these trade guys. Legally, a BDS student is taught ortho, so he can do ortho, but they are not competent enough to do it.
Yes. So we know that Invisalign at least maintains quality, but there are so many other which have mushroomed. At home orthodontics, and patients are ordering it online and using it. So there are a lot of complications associated. So these are legal loopholes. Unfortunately, the Indian legal system is not so strong that people continue to sue, but they can't afford to do it in the Western countries. In fact, the educational institution should also be sued, because it's their moral duty to ensure that whatever the DCI recommends, everything is implemented. So they're not doing it, they're definitely in a legal soup there. It's not happened before, but it can happen anytime. Our generation is gone, the next generation is very strong. Okay, so now that you have identified different gaps, look at what is the quality of the graduate that you want. What level should your learner be able to perform? Usually competencies, we always look at skill. So it's not just medical knowledge, but also application of the knowledge.
I think this aspect is totally missing in our curriculum, current curriculum.
Yes, sir. Yes. So that's why I want to explicitly draw your attention to this. We should always think of the end product. Now, let me give the example. The hot running topic is the Ram Lalla idol. So how did Arun Yogiraj sculpt it? He was looking at the final object. He said there is never a reference image. So what he did, he went to different schools, observed the children playing. So then he studied the difference between a 3-year-old child, a 9-year-old child, a 5-year-old child. What should be the facial features? How should the divinity be there? What should be the type of ornaments the child should wear? So he studied everything. Then he had an image form in his mind. So like that, you need to think what kind of a graduate I should produce. Where should this graduate be able to work? Which kind of, what kind of people should these graduates treat? What quality I expect in my graduate? So a lot of thought process goes into this. Okay, so please think deeply and identify what qualities you want in your graduates. And once you are ready, let's share that.
Let's say, madam, we are speaking more of implantology and all, like Narendra sir was saying, like whether there is no demarcation, like whether an undergraduate student has to place a single implant or multiple implants. Madam, what we inquired with other colleges, in few colleges, where in Tamil Nadu and in Andhra Pradesh I inquired, there what they have done is they have done mandatory for undergraduates to place one single implant, give a crown, then become eligible for the exams. So when we thought of this course and we thought like whom to take, like include in this course if we are trying to revamp the curriculum or put an addendum to the curriculum, we thought only those students, like in NAC we have slow learners, fast learners. So let's say we take up those fast learners in our this thing, like our focus group, and train them so that once they're out as a BDS, at least single unit cases they can handle.
Yeah. So as a faculty, you will decide like whom you want to be trained. So you're setting a cutoff level and saying, okay, I'm going to take this kind of student. So this is good. You're fixing what is called as an eligibility requirement.
Yeah.
So maybe you will have an initial training in anatomy, physiology, bone anatomy, whatever it could be, of dental materials. So how they perform in that section, you will determine whether they are eligible to receive the skill or not.
Yeah. Then one more thing, madam, I have a personal doubt whether it is relevant to this or not. I don't know whether others are finding it easier to understand. OSCE and OSPE, madam, it is very easy to apply for medical graduates. But when it comes to dental graduates, it is like, frankly speaking, it's very difficult for us to implement in our curriculum. Like, let's say, madam, whether we have to assess their complete denture work or implant work or FPD work. How do we implement that, madam, or how do we assess that using those protocols in our field, madam? Any idea, madam?
I'll come back to your OSCE and OSPE. I have personally designed OSCE stations for dental students. So let's understand the spirit of OSCE. Okay, I'll come back to that. But right now, I want to focus on this intended graduate thing. Assessment part, I'll definitely take up your question, Dr. Siddharth.
Okay, madam. Okay.
What about the
Madam,
others?
one big gap is defining the context in a when the regulator designed the curriculum way back in probably 1948 Dentist Act. The context of that times and current times are totally different. And even today also probably some parts of our country may need primitive dentistry and many parts may need modern dentistry. But we are creating a graduate who has got a certain competency, and we always say that there is not much of opportunity in the urban areas, they have to go to the rural areas. So why not develop a curriculum where, like in the current new education policy, a student can be trained for 3 years and can be certified that okay, he can practice a dentistry to this level, probably only in the rural setting, and then he's trained for another 2 years, and you can say that okay, he can practice at this level. So is it possible that way also?
I will not put it as rural and urban.
Okay.
I'd rather put it as basic dentistry and advanced dentistry.
Advanced dentistry.
Because advanced dentistry can be provided in a rural setup also.
Yes, yes.
Right? There is no moral way where we can deny people advanced care just because they are in a rural setup.
Correct.
Okay. So basic dentistry where restorative care and basic prosthodontic care, scaling, all this can be performed, preventive care can be performed. Yes, that can be definitely looked into. That is one way of approaching of a training program. This you can also look at by developing electives. If you look at the NEP, it allows for lateral movement. Any course, any science student can move into arts and can move into commerce, so that is there. And they're struggling to find out how do we implement this on ground. If you look at dentistry, I did look at the integrated curriculum, the elective based curriculum, and they had a provision where students can learn Ayurveda. And there was another track where they can be certified as oral biologists. Yeah, so these kind of alternate tracks are possible. So this is going to
Yes, ma'am.
happen.
Bridge course.
Yes, bridge
Something
course.
called as a bridge course.
Yeah, so these things are going to happen when you have a module-based approach. Let's say a module in year 1, which is going to cover the basics. And in year 2, the student chooses which track they want to go to. For example, when I did my master's course from Maastricht University in Netherlands, I had an option to develop additional competency in 3 domains. I could be a curriculum designer, or I could be a curriculum leader, or I could be a curriculum researcher. So I always had multiple electives. I can choose which one I want to excel in. So I would decide based on my requirements which elective is going to help me to pick up those skills. So I had this option. So module based, elective based are going to give you that flexibility. We use the term flexibility of choice. So did you all identify the quality of the intended graduates? Who would like to share it?
Ma'am, I have noted down few of the aspects. Graduate should be possessed or competent enough to be able to practice after completing his basic graduation.
That's a very broad statement. Let's restrict it to one small component of the gap you have identified. For example, let's say the preclinical implanting. You wanted to include that, right? So if that's the goal, what should the quality of that? Here I have used the word graduate. It should. You can also look at the end of your course what that person should be able to do.
And the basic knowledge of research methodology. So if the student is willing to go for the post-graduation, they will not be suddenly exposed to this research criteria. They will have a gradual transition from the basic knowledge to the advanced knowledge.
Right. But what are the qualities you expect in them? What is it that they should be able to deliver to your program? What is your end product? So you can say, like, at the end of this course, the student should be able to critically evaluate.
Minimum knowledge of the biostatistics and research methodology.
So when you use the word minimum, what does it mean?
Okay.
We cannot use variable terms. We should be able to use accurately measurable terms. So you should be able to specify and say at the end of the course, the student should be able to identify different research designs in both quantitative research, qualitative research. Or you set a higher bar and say at the end of this course, the student should be able to write a research proposal. It's a higher level of degree. No, first one is only recall. Second one is they should be able to apply their knowledge. Or will you say at the end of this course, the student should be able to independently undertake a research project. So depending on your end product, you will decide what is the content of your program. Okay, so what is the content of your graduates? Yes.
This is also missing, ma'am. Actually, in every statement, that measurability is missing probably in our.
Yes. So your curriculum should be able to evaluate it, right? I said that. So how will you evaluate? Only if you have a measurable term will you evaluate it. It's 7:20. Do you guys want a 5 minutes break? Or shall we continue the discussion?
We can take a break, ma'am. 5 minutes.
Okay. It's all up to you. I'm okay either ways.
Mm. Madam, in this course, what are we exactly supposed to do regarding curriculum development?
In this module, which I'm training,
Yeah.
at the end of this module, you are all expected to develop, design your own modules. So what theory or whatever you are learning, you should be able to practically apply it. Today
Design the curriculum.
we are not,
Yes, ma'am.
see, designing a curriculum is a very big project, no? So we are doing
Yes,
pilot
ma'am.
designing. So we are going to design a small module or the small curricular content part of it. So that's why identify the gap which aspect you want to focus. So madam identified research skills and undergrad students as a gap. So someone else identified clinical implant gap. So like that, identify what is the gap. That is the first step. Next is what should be the student be able to do at the end of your course, what you have identified. So you say it's a gap. What should be the end product?
So that module should be in its entirety, up to the evaluation,
Yes.
feedback.
Yes. Everything. The complete picture should be there. Okay. I guess nobody wants a break because nobody is asking for one. Let's continue. Okay.
Yes.
Anyone else wants to share
We
this?
are not used to a break, ma'am.
Okay. Okay. So anyone wants to share what is the intended product quality they expect? So we learned that we cannot have variable terms. We should be very specific, very measurable terms. Right? What else? Let's share and learn together.
The student should be able to empathetically manage a patient.
Yeah.
I don't know how to make it measurable, but
Yes. So empathy, we do not have any this thing. So what we say, how is the patient, how is the student able to effectively communicate, convince, or demonstrate that he or she understands the patient. So a lot of the focus of your content will be on training the student in developing that empathetic quality. What else? What else is the intended graduate with this thing, end product value?
Ma'am, he could be able to diagnose a problem which a patient's come with. Like a patient comes with specific issue, he should be able to give a diagnosis of that issue, which could lead to subsequent treatment plans.
I agree. But are you focusing on a component of your curriculum or are you focusing on a very big aspect?
That's an end product that a graduate will be seeing. Diagnosis is a part of it, which would be he should be knowing. Like we know the empathy or the communication skill. This is a part of our accomplishment.
I agree. If you're talking of a BDS graduate, then being able to diagnose is absolute requirement. Now, at this stage, I'm asking you to identify, you have identified a learning gap, right? So for that, you are designing a program or designing a course or designing a module. So at the end of that module, what should your end product be? So let's bring it down. So if you say diagnose, then for diagnosis, your student should have oral pathology skills, medicine skills, radiology skills, everything. It becomes a very big component. So bring it down, scale it down and say, because of your course, what should be the final outcome?
the student should be able to effectively manage gagging in a patient when making an impression.
Absolutely. That's a very specific outcome that you have identified, right? That's a learning objective. So So what quality you want in your patient? Empathy is one quality you want in your patient. Having the knowledge and skill is another quality you want. Becoming a self-directed learner is another quality that you want. So like that, you should be able to specify. Okay, so move on to the next point there. What kind of curriculum are you looking at? Are you looking at outcome-based or are you looking at competency-based?
Ma'am, competency can be one of the outcome, na, ma'am?
See, whether you are looking at a traditional curriculum, whether you're looking at a competency-based curriculum or looking at an outcome-based curriculum, should be specified in the beginning.
How can we make distinction between outcome-based and competency-based?
Yes. So outcome-based curriculum is a very broad umbrella under which competencies fit in. You have got outcome statements. We use another term, not sure you have heard of this. We use a term entrustable professional activities, PAs. Then there is another set which speaks about milestones. So those are all outcomes. Competency says at the end of this 5-year program, or at the end of this course, the student should be able to do this at this level. So you decide which curriculum you want, competency, outcome. Nursing curriculum and all is outcome based. Medical curriculum is competency based in India currently. A lot of engineering colleges is outcome based.
Okay.
So did you all decide what kind of curriculum you want?
There is
Moving.
in outcome-based, is there a risk of being very broad-based and not identifying specifics?
No. It all depends on how you jot it down. I can have what is called a program outcome. So you must have come across these terms in your NAAC accreditation. So yeah, you can have a program outcome, course specific outcome, objectives. So it works at different levels of hierarchy. Okay. Now, this is something which we would not have considered previously. So try to integrate these aspects into your course. How will I make my course student-centered? How can I ensure that it is a problem-based learning? Because there is a context, students are going to learn based on that. I'm not going to go with a didactic. So how can I make it? How can I look at integrated? How can my students learn in a community setup, understand the problems? Will it have electives? Is it a systematic approach to learning, or is it just an apprenticeship model where, just you stay in a department, you observe, you learn, and you move on? So are we going to have something like that? So what is the character of the course? One disclaimer I'll say, no institution has 100% implemented the SPICES model. Because the literature does not say that SPICES is the best. They have tried to incorporate what is appropriate in their context. So some have gone with student-centered problem-based learning with electives. Some have adopted community-based integrated problem-based learning. So like that you can have whatever. From the traditional teacher-centered curriculum to this, how much you are moving towards the SPICES is all that is important here. It does not say that SPICES is the only method to go with.
But at least few components of the SPICES have to be incorporated.
Absolutely, absolutely. If you can incorporate all of it, let's say like a 40% of traditional, 60% of spices component, it's absolutely good. So the homework will be, please look at how we will make these things happen. Okay. Now, based on the framework you have selected, you will have to design your curriculum. So you have identified what I want. Now it's a question of curriculum organization. How am I going to structure it? Am I going to look at an integrated curriculum where students are going to learn about one particular disease or a component in continuous nature, like from anatomy to physiology to the pathology, treatment, everything, they're going to learn it at one shot? Or am I going to look at electives option? So there are some basic things they have to learn. There are some electives which they can choose. Or am I going to look at a spiral model where, let's say in year 1, they're going to learn a little bit of it. Year 2, advanced learning. Year 3, much more on the same topic. Year 4, much more complicated. So am I going to look at spiral model? Or am I going to look at a module-based approach? So let's say in year 1, research methodology, they learn everything on research-related aspects. And then we are going to move on to some other module. Okay, so you decide what kind of a design you want in your curriculum organization. So you are talking of the pre-clinical implantology course. So your preclinical implantology, are you going to give it at different complexity levels for first year BDS students, second year students, third year students, like that? Or are you going to say it doesn't matter which student is in which year, they're all going to learn the same module? Or are you going to say, okay, somebody, they'll do the basics, that is the core, then they'll have an option to specialize in different components of implant? Or are you going to say, we prosto, ortho, surgery, we'll all come together and we'll teach them? So you choose how you want to deliver your model. Okay, did you make the choice?
Yeah, ma'am.
Ma'am, can you repeat core and options?
Core and option is nothing but your core subjects and electives. So I told you, no, I had this option of becoming a curriculum designer, like that. So you choose which one you want to specialize.
And modular structure will be, madam?
Modular structure is, they'll finish that module, then they will not revisit it again. For example, now your whole course is module based. So you, what was your first module?
Team planning, I guess, madam.
Learning and teaching methodology.
So you did a module on learning and teaching. Are you revisiting that module now?
No.
No. So that's
We
the
have
module.
to have a project. We have a project now.
You have a project is different, but you're not having any training sessions on that. Isn't it? You are done with it. Next module
No,
is
it's ongoing.
So your next module is curriculum.
Yes.
Right. Some models can be both integrated and longitudinal. For example, your leadership module. I think your leadership is spread throughout your entire thing, or even your project is spread throughout, right? So you can choose how you want it to be. Okay. Shall I go ahead?
Yeah, ma'am.
Then you decide based on your learning objective, you have identified what is your end product, no? So what is your instructional approach? Do I want case-based learning? Do you want problem-based learning? Am I going with team-based learning? Am I going with a didactic approach? How will you design your case-based learning?
Maybe probably, madam, instructional approach.
Correct, but you have done your learning teaching methodologies, no? CBL must have been discussed. So how will you design a CBL case? What is the reason why you have a CBL discussion?
Ma'am, it's a student-based aspect wherein a student learns and discusses with the faculty to a specific case.
Okay. Yes, it happens in CBL, PBL, and TBL also. What you said. In CBL, you have a specific case being given, a patient scenario being given. So the patient scenario, you're going to give the patient scenario and you're going to have specific questions on that. And the questions can be related to anatomy, physiology, pathology, or whatever is the aspects that you're trying to teach them. So because it's an application-based learning, the student will have to read and come and discuss or present the case with the peers and the faculty. So there's a lot of learning happening. So that's what we're going to be doing with your cases also. You'll all design your models, come present it, and we will discuss. Okay, what made you do this design choice? Why did you choose like this? What is your other strategy? So we will discuss and we will all learn together. So that is a CBL. What is PBL?
A problem-based learning, ma'am, a specific problem being given to the students who discusses how to resolve those problems.
Yeah, and usually PBL learnings will also happen in a group. It can also happen individually. It depends on how it is constructed. For example,
Ma'am, can it be what type of problems are being faced by the student in that particular subject? And we need to design our program to address those problems?
no, ma'am, no, ma'am. Let's say the student is told there are 25 geriatric patients living in an old age home. How will you identify their oral health needs? So there is a problem. It's a real life problem. So these people together as a group, they might have to identify what is their oral health needs. So they'll have to think, okay, where is the location of this place? How will we reach there? What all equipment we need to do the initial screening? How will we record it? How will we come to a diagnosis? This is one problem which they can all solve together, where practically they'll learn in a community-based setup how they can provide prosthodontic care. A problem can also be different. It can say, you have given this particular impression to a lab. The lab has sent back something. So commonly you will come across a problem of mismatch, no? With the lab, whatever crown they give and how it is being fit. How will you solve this issue? The student will have to think, should I resend this? Should I repair this? Or is there any other way in which I can salvage this? Okay, so an authentic problem, a real life problem faced by clinicians can be designed to teach the student errors of dental material processing. Okay, so like that you can design. Team-based learning have already given an example where students learned it together. Didactic is, I just have a lecture session on this. So if you want to train your students in research methodology, are you going to give them an hypothetical situation and say, design a research proposal for this project for the oral health survey of geriatric patients in an old age home? Or if you do a PBL, how are you going to do it? So PBL, you're going to give them a problem and say, in a cross-sectional survey, this was the finding. Can you interpret the findings? Right? So like that, you can design it. So which instructional approach you want to adopt? And it does not say that you should adopt only one method. You can say a mixture also. I'll have CBLs and PBLs, or I'll do CBL and didactic. It's up to you. But you have to justify why you have chosen what you have chosen. Fine?
Madam, it should be like all these methods can be used in different contexts. In this
Yes.
context, I am going to use this method, and on some other context, I will use a different method.
Yes.
But we will use all the methods.
You can use any method, but you have to justify why you have chosen that method. Because we want to have critical thinking. Okay? Are you
Ma'am,
how?
this team.
Huh.
Sorry, ma'am. Please continue, ma'am.
No, please go ahead, ask the question.
Ma'am, TBL is also called as task-based learning.
It can be called task-based learning. It can be called team-based learning. Okay. How are you going to deliver your module? Which is your mode? Are you doing blended, online, face-to-face? Now
Online.
you're having an online program, right? So flipped classrooms can also be used as a technique where the student is to come prepared and then you're going to have a discussion. So in fact, that's what we will do in the next session. We have shared the learning material. I would want you to go through it, identify who is discussing which article. I think I shared around 4 or 5. So there are 10 of you. 2 of you can present the same article and say, what is your learning from that article? So that's going to be a good learning experience for all of us. Okay, so that can be a flipped classroom that we are trying out over here. Fine. Explicitly mention these things. What is the vision and mission?
Articles are shared in LMS, madam.
Pardon?
Those 10 articles are shared in LMS, madam.
I believe so, sir. I mailed it to Suhasini, ma'am. I'm not sure
Ma'am,
where.
can you please
Because-
post in the WhatsApp group, ma'am, because it's difficult.
I am not added to your WhatsApp group, so that is the problem I had.
Madam, if you could put your mail ID in the chat box, then we could
Yes,
directly mail you.
that I will do. Okay.
Because in LMS, madam, like I was seeing, they have put articles somewhere around, if I'm not wrong, 30 to 40 articles. And
Okay.
it was more of all medical oriented.
Yeah.
Yesterday, I spent somewhere around 6 hours. That is why I asked you the doubts, madam.
Okay. No, see, even if they're put related to medical, it would be medical education technologies or health professions education technology.
Because those terminologies are not like, we are not well versed with those technologies. Frankly speaking, madam, there is very much less. We attend faculty development programs in different universities. Right now, it is happening in Kerala. One is happening in Bangalore under RGHS. But none of the people speak about all those things. It's like a diversion kind of thing.
Absolutely.
So those articles, when we were going through, it was going like bounces, man.
Yes.
So
Yes,
because you are from our field, if we address our problems too, I feel like it's been getting clarified in a more practical way, madam.
and I'll be very happy to sort it out. Not an issue. But yes, I
So
understand.
if you could share your mail ID, madam. Personally, if you allow us, madam, we can just send you our doubts, madam. Because even last class also, Mirna madam was asking some help from me also. I was not able to solve her issues. Even when she put it in the class also, I found that whatever she was asking, even I too had those same doubts. But I hope it didn't get clarified by the end of the session as well.
Okay. I'll be very
I am doing a project on the DOPS and I studied lots of article. Even I found it was confusing for me because ma'am told me that you have to focus on single aspect, any particular thing, that is the either removable processes or fixed processes, like that, those things. But what I found, what other people have done, like in for the conservative or perio, they have taken 8 to 12 parameters, and the top questionnaire is fixed. So I do not know how to, if I am doing the suppose for the removable, suppose for the complete nature I am doing, whether I can change the questionnaire of the DOPS or for
Can.
that procedure. I mean to say, ma'am, suppose I am taking a primary impression and I want to set the criteria for it, that what will make that primary impression ideal. So, like the border thickness, like the anatomical landmarks have been covered. Where will I fit those criteria in the DOPS questionnaire?
Ma'am,
I do
DOPS,
not.
you can always modify it.
Ma'am, in that questionnaire, what I got in a crude format, the analgesia is given, the physical and the general examination is given. So what I have to do in that format, my whole questionnaire will be changed.
Let's just try to understand this assessment process. See, DOPS is direct observation of procedural skills, right? And when you look at it, there might be hundreds and thousands of procedures which are carried out by health profession educations. I mean, medical
Yes.
experts.
Yes,
right?
yes, yes.
So everything the subject experts will have to prepare a checklist.
Yeah. Then where would I fit that checklist in the DOPS questionnaire? Suppose they have given that, you have to tell, suppose I am doing in the complete denture fabrication procedure, suppose there are 5 steps involved or 6 steps involved. For each step, I had to modify that. It is given that in the DOPS questionnaire that whether this is a difficulty level is mild, moderate, or very difficult. So I'll fit that. Suppose primary impression in making is a moderately difficult procedure, or border molding is a more difficult procedure. Trying is a less difficult procedure. It's like that way. But can I modify the question like they have given the case history, general examination, analgesia label? So how can I change the whole thing randomly based on my criteria?
This is where it differs. See, you are a subject expert. You know what your student should be able to perform. So based on your knowledge, based on your understanding, you prepare what we call a checklist or a rubric.
Okay.
So let's say you prepare a checklist first. You say, these are all the procedural steps I will be directly observing when a student is performing. Then there might be some simple steps which a student is easily able to do. There might be some moderately difficult steps. There might be some extremely difficult steps. So you, in your expertise, have given a weight to each component of that, saying this is a simple procedure, this is a mildly challenging procedure, this is a moderately challenging procedure, like that. But you're not sure. I might have done like this, but I'm not sure whether what I'm doing is right or wrong. Then
but how can I then claim that this is DOPS? Because I have changed the entire whole thing.
it doesn't matter, because you have followed what is to be followed. The standards you have followed. So the checklist, whatever you develop, and you're going to develop a rubric along with it to say, on what basis are you considering that the student has successfully done this procedure?
Okay.
So
Suppose, ma'am, if I want to take certain standard criteria, then I have to take the reference of the textbook or article for that. That what is the ideal characteristics of for that? Suppose impression making. I'll say that.
To you, we are not going to say that you should take a reference from a textbook only. You might say that it is how it should be. Then what you do is you also have a team of experts who will validate this tool along with you and say, yes, what this tool is saying is we agree with it, we disagree with it, or this can be modified.
Suppose, ma'am, I can make a, suppose I can make those criteria, and based on that, I can share in this group, and they can suggest me that whatever criteria I have taken or what are the justifications. Suppose for the ideal impression making, let's take this is the basic steps, that all the anatomical landmarks have been covered, the border thickness is have to be this much, the border should be rounded, and all those things. And I'll send this to Nagda ma'am. Then in our panel, can they validate that things for the whole?
They can.
Okay.
Because it's your prosthetic expert panel who's doing it.
Ma'am, I'm getting I thought that if I do this way, then the whole thing that because whatever article I am following, they have not given any annexure. So they have given the result. Never, they don't have, they have not at all shared me the modified DOPS form, what they have modified for the periodontics or for the conservative. They have only shared the result part. So I'm unable to get, like Asuni ma'am told me that you go through the articles and see how they have modified it.
So what I always suggest is this is where we lack as Indians. This is my observation. We don't go to the root theory. As in, From where did this docs originate? Who designed it? Why did this person design it? What does he say? DOPS was designed by John Narsini. I happened to meet him also in the APMSC conference. John Narsini developed it as part of an standardized assessment strategies. So he didn't design only DOPS. He also designed mini CEX. He also designed the 360-degree evaluation and all that stuff. He has given his idea and said, this is why I recommend this.
Ma'am, one more doubt, like the difference between DOPS and OSCE is that is OSCE being performed in a simulated environment and DOPS is performed in the original situation? Is it like that?
And do you know Miller's pyramid?
Sorry, ma'am?
Do you know Miller's pyramid?
Yeah. To show that you know the clinical procedure, it's like that. The basic thing is you must know the basic things, then how it is done, then the apex part is how it is clinically being performed, that I remember.
Yeah. So when you talk of a Miller's pyramid, it's always a hierarchy. So at the bottom of it is going to be knows how.
MCQ, yeah.
Yeah, knows, right? So next level is going to be the knows part of it. Then next level is going to be the shows how. So it is in an artificial environment that the student is performing. So all your ASCIIs are going to be on simulated patients or on artificial patients. So it's never in a real context. Shows or performs where they're doing it on a real patient. Okay, so the apex of the pyramid is your shows component. So all your DOPS, mini CEX, which are performed on real patients, comes at this category.
And ma'am, would you clarify the difference between the DOPS and the mini CX?
DOPS, I believe, is a component of your mini CX. It can be looked at it like that also. It can be looked at in another way. Now, many assessments, in many exams, they expect a patient cases to be there.
Case history.
Case history to be there, right?
Yeah.
So for that purpose, you can always use a mini CEX, case side examination. Okay, and you can't spend 1 hour standing next to a student to see how well they are taken the case history. So in mini CEX, you have all the components properly prioritized. So when a mini CEX format is full, you know that the student is able to do these things. DOPS is direct observation, wherein the supervisor is standing next to the student when the student is performing.
Suppose, ma'am, a student is performing the impression procedure, how the student is doing the trace selection, will that come under this?
Absolutely, it will come.
Yeah.
It again depends. Do you want to have 25 steps in this, or do you want to, merge a few steps? All up as the one who is designing the DOPS.
Okay, ma'am. I'll come back to you again.
You are most welcome. I'll be happy
Can
to
you please share your phone number or mail ID in our WhatsApp group?
I will do.
Lots of help. And those articles, ma'am, actually we are getting difficulty in downloading them. So if you can send them in the WhatsApp group.
I am not added to your WhatsApp group, so if you add me there, I can share those details also.
I am not the admin. I suppose in this panel, if any admin is there.
Madam, if you could share your mail ID, then we will share our mail IDs to that ID.
Ma'am, even if you can send it to Meenakshi, we can take it from her.
I will do one thing. I'll send you my phone number and email ID. Please send me an email and get connected.
Yeah, okay. Yeah, madam. Yeah.
So please focus on the learning teaching method. And when you're teaching, we expect our students to be self-directed learners. We want them to be able to independently learn a few aspects. So what learning resources are you providing? Now, for example, I expect all of you to be self-directed learners. So I've provided learning resources. But how well is the student able to use it? That also matters. What kind of feedback and support is provided? Now, I want you all to design your own module and present it next week. So once you present it, because there are 10 of you, it might take us 2 sessions or 3 sessions to go through all of it. So we will discuss like how we are providing feedback, and what kind of additional support you need. And based on your practical and clinical experience, where and how you're going to be delivering your module. So all these aspects, you need to consider it when you're designing your instructional module. Okay. So like I said, self-directed learning, or are you going with distance learning? How you're going to provide. Focus on your assessment also. Are you going with the formative or are you going with summative? Are you going with an LMS? Do you have a team who will help you to deliver it? What is your evaluation strategy? How are you seeing that things are happening? Okay. Yeah. So I'll stop here at this stage. I wanted to go back to those articles. Now I'll stop sharing. And yes, I can answer any of your questions. Where is your chat? Okay, here it is. I'll answer the OSCE question. But is there any other question? Please go ahead and
Ma'am,
ask.
now we have understood the concepts of curriculum designing, various models that we have. And
Yes.
now we wanted a map of how to design, ma'am. If we can have a basic map or a kind of a thing which we can follow it through, so that because it's our first step in designing.
Flowchart,
So if we have a specific model specific map kind of a thing which we can jot it down and can proceed.
Kern's model. Okay,
Kern's
use
model.
Kern's model as a hypothesis model. Then for discussion, right, now, I've asked you around 7 or 8 questions, no? What is
Madam,
your
which model, madam?
Kern's model?
Kern's model.
So, and for discussion also, I asked you some 7 or 8 questions. What is your instructional design? What is your learning goals and all that? So focus on those things. I'm new to Teams, but how do I add a file? Does it allow to add a file in your chat box? I can't see
Madam,
that.
in share, okay.
Share a content, ma'am. There is an
Ma'am, you can
option
share
to
to
share
somebody,
content.
they will share us.
Sure, please send me an email. I'll mail those articles across. No problem. Okay. Now coming back to OSCE and OSPI.
Madam, can I ask one fundamental question?
Yes, sir.
In between your lecture, you told us that this course is a module-based course, which of course we know that there are 5 modules, but the confusion is it has been delivered across modules. I think 2-3 modules are been delivered simultaneously, leading to some confusion. At least for me, I'm a little confused because probably based on availability of our teachers or mentors, I think particular topics are fixed in a particular week. So I think we have not finished with one particular module and going to the next module. We are at a time, I think 3 modules are being, or at least 2 modules are going on simultaneously, 2 or 3 modules.
But you
So,
still module-based approach only, because
pardon,
you still have a module-based approach.
okay.
Modules can be delivered longitudinally, but we are not integrating the modules and teaching you. For example, if I'm talking of curriculum design, the whole focus of this model is on curriculum design. I'm not jumping and teaching in detail the learning teaching methodologies. Wherever you have doubts, they're clarifying it.
Yes, because still we have not been taught about in detail about OSCE or OSPE, like Madam has taken DOPS, but Maybe madam has researched a lot on DOPS, but we don't know anything about DOPS.
Sir, I'm still confused. I'm in the middle of the ocean.
Exactly.
No, you took a topic and you know more than us, but we don't know anything about DOPS. The point I'm making is we are learning as we are moving ahead, but
Yeah.
at least some things I think we should finish. All the teaching methods or assessment methods. Otherwise, it's becoming a little confusing.
It doesn't matter, sir. See, sir,
Ma'am,
I see it as a spiral learning.
Ma'am,
See,
can I request you one thing?
one second. So when we are learning something in the very beginning, we may not be able to take in everything. So maybe we absorb about 5%. Then you revisit it and revisit and revisit it. This is my 14th year in medical education field as such. So that's how it goes.
Okay.
Yeah, man, please go ahead.
Ma'am, can you take a session, please, on DOPS or whatever project we have taken? If we people are having some doubts in context to that,
Yeah,
can we take?
please put in a word to Suhasini ma'am, then we'll figure out. See, the
Ma'am,
challenge for me.
Ma'am and Asuni ma'am has given the task to me to go through lots of article and find out. But I'm still
Madam, I
confused.
went through LMS yesterday, madam. Trust me, madam. I had a map how to do my project, but after going through my articles, if you remember, madam, the sample project what they had put in the group, wherein in the methodology at the end how you evaluate them, outcomes and all, I totally messed it up, madam. I couldn't get a track again how to do. I had discussion with Chinmay sir, and within this 1 week, 3 times I have started doing corrections. So I thought, no, again I have to go back into first thing, then go ahead and do. Yesterday I was going through in and out like how to do OSPI and OSPI in dentistry, especially when we are involving any clinical procedures. So I asked madam, like, please throw some light, madam, if it's a clinical procedure, then how we have to do? Because majority of us who are doing on clinical procedures, be it Mirna madam or Arun sir or me, the evaluation part will become very difficult because those outcomes, short-term, intermediate or long-term goals, whatever it is, to structuralize it at the end, it is becoming very difficult for us, madam.
See, OSCE is simply a clinical examination in a simulated environment. It is not a natural environment. What we mean by that is, if the student is doing it live on a patient and you're directly observing it, it becomes direct observation of procedural skills and a complete thing. In OSCE, you're going to break it up into small stations. Let's say that you're training your student to make a impression. So a student cannot directly make an impression, right? They'll first have to talk to the patient. They'll have to take their case history a little bit at least, and then prepare the impression material, then make the impression, and then probably pour a cast. I assume that these are the steps involved. So for each of it, you make a separate station. For example, you have a station 1. In station 1, the student is to build a rapport with the patient. So how the student is approaching the patient, how are they communicating, all those things can be observed. Now again, there are two things. One, in that station, you can have a real patient. We usually don't call it a real patient, we call them as trained actors, because they are going to be trained as to how to respond to your students' queries.
Ma'am, can they be third-year students also? Because I read somewhere.
Or because of cost cutting, we will put interns, we will put students, etc. And this final year student or whoever is performing is going to be stage 1 or station 1. So in station 1, what all things will happen, how will the student get graded is going to be recorded. Then after 5 minutes or whatever time you give, the student will move to station 2. Another student will come to station 1. So it is going to go in a round robin thing. So when the student comes to station 2, the second step is going to be how are they recording the case history. So if you want to measure that, that is going to be there. The third is going to be how are they going to select that impression tray. So at each stage, you need not have a patient only. You can keep a model, because obviously you can't get that many number of patients for everything. So you're going to keep a model, edentulous model, and you have a series of trays there. The student is going to select the appropriate sized tray. So how are they doing the selection process? So that also matters. Then there's going to be the material they are going to take in. So then how they are maintaining that material. I have forgotten a few prosthot terms now. So then how are they going to make the final impression? So like that you have stations. So one whole process is divided into stations. It is in an artificial environment or what we call a simulated environment. And student is showing how these steps are going to be performed in real life. It is not a real life. That is the difference between your OSCE and DOPS. Is that part clear? Yeah. When it comes to OSCE, it is a clinic. OSCE is clinical, P is laboratory based. That's all. Okay. So we usually use it at the first year, second year level. If you are doing this kind of a thing for your dental materials, then it becomes an OSCE.
Ma'am, I have a question.
Yes.
Ma'am, you said this for making the impressions, like you have to have so many stations. Is it necessary that all the stations have to be there for one student, one station, and can he go to the next type of jorlation or something like that? Do we have to go through all the
Look,
steps?
the golden rule in assessment is the assessment should be standardized, which means that all students should be able to perform a similar level of case. Right? When you have patients, real life, it may not happen because patients are going to come with different complexities. Some might have a tongue thrust. So there are different challenges. To ensure this standardization happens in an assessment stage, OSCE was designed. So usually a student has to go through all the stations.
Ma'am, DOPS is a cross-sectional study or a longitudinal type of study?
DOPS.
Yeah, because same student, a single assessor is going to assess one time or multiple times
Ma'am,
for the same procedure.
patient is only one, no?
Yes. Suppose it is one thing that was written is that how far the student has improved.
See, if you want to, let's say, take a best of 10 scenarios. So in all 10 scenarios, you have had DOPS. For example, we do this mainly for postgraduates because they are going to do similar type of cases often and often, right? So in that condition, yes, you can say the student has done this performance and we have observed it 10 times. An aggregate score can be given and say, okay, a student is performing at this level. So we certify that they are competent.
And for the each assessment, the assessor has to be different or it is the same assessor? Suppose I am observing the student for the impression procedure. For the second, third, and fourth time, the assessor has to be different or I have to be?
All up to you. There are no hard and fast rules here.
Madam, DOPS is also objective. Madam.
It's all a mix of subjective and objective which comes in. Look, we know how much of variation is there when you all approve the teeth placement for second year students or for final year students. One teacher will say, yes, this is good. The other teacher will say it is not good. And the student cannot figure out what went wrong. Is it the teacher's mood or is it the tooth placement? That is why we want to make it as objective. So when you are using objective structured clinical examination, there is an important element called rubric which has to be developed. It says whether I assess or Rohit Kumar assesses, the score should be the same. In DOPS, there is always a subjective component which does come in, even though there is a structure, because it is a direct observation. So you may not feel happy with what it is being there, right? You can never take out subjectivity from assessment. Even in
Thank you so much.
There.
Can I leave, ma'am? I have some work.
Sure.
Yeah. Thank you so much, ma'am, for answering my question.
Yeah. Anything else? With that, I'd like to close now. I have received your emails and WhatsApp. I will be forwarding it across.
Next week we'll be having your class, ma'am.
Next week I have my own training. That's the problem. I'm tied up on Tuesdays and Wednesdays. So I asked Suhasini ma'am to ask you whether any other day is fine. At least for this module, till we discuss this module.
So we'll have to read those articles and come prepared whenever it is.
Read those articles as well as prepare your module. Otherwise, there's no point, right?
Okay.
Yeah. Okay. Please feel free to message me or call me. I mean, if I don't pick up, please leave a message. I'll get back to you on that. If I'm added onto the group, then solving your doubts becomes easy because I can leave a voice message or whatever and we can discuss it. Okay. Thank you and have a good night. Bye-bye.
Thank you, ma'am.
Yes, ma'am.
Thank you, ma'am.
Thank
Good
you.
night.
Thank you.
Thank you, ma'am.